When it comes to surgery specifically, you don't never want to be part of a trend. You want to do something that's timeless.
Yeah.
So in general, I'm very conservative, and I'm hopefully doing something that is going to be long lasting. I think one great example is everyone wanted to get their buccal fat pads removed. We saw it like crazy. Everyone just, especially in New York, everyone wants to just be like,
very gaunt, very 90s.
So you have to be selective because there were so many people that they were taken out, it should have been removed, or they took out too much, over resect it, and it's a difficult problem to reverse. And that was super trendy, and I was always very conservative. I think in general, though, we're seeing a shift, thankfully, to more natural appearances. And I think there was the whole Kardashian effect with the big butts and overfilled faces and big lips. I think we're thankfully coming back to a more elegant and timeless type of look.
I'm Dr. Anthony Rossi, and this is Give Good Face, a podcast focusing on skincare science, and how to maintain and shape a healthy lifestyle. All right, welcome back, everyone. This is Give Good Face, the podcast about all things beauty, science, skin. And today I'm really fortunate to have one of New York's best plastic surgeons, Dr. Ira Savetsky, here with me. How are you?
I'm doing great. Thank you so much for having me.
Yeah, thank you so much for being here. I think you are the first plastic surgeon on this, so you should be honored.
First and most important.
Exactly.
And maybe hopefully the last.
Yeah. And so tell us about yourself, because you grew up in New York too, or?
I grew up in New York. I grew up on Long Island. Stayed in New York pretty much most of my life, except for medical school. I was in Philadelphia. And then I went to fellowship after residency for a year, and then stayed for a couple more in practice during COVID era. So, but New Yorker through and through.
Yeah. So you have the New York savviness, the New York aesthetic, but you did do fellowship in Dallas, right? With the famous
Rod Roark. Yeah, I did my fellowship there, and training in New York in residency, similar to you develop sort of the techniques that they do in New York. So I really wanted to sort of widen my techniques and then come back and kind of do a hybrid and sort of do the best from everything that I've learned.
That's great. I mean, a lot of medical students ask me, like, should I stay at the same institution? You went to an amazing residency to NYU, which is well known for plastic surgery. But it's also good to get out and see other techniques. Yeah.
Yeah, I think that's a really good point, because as hard as it was to get my family to get up and move for a year, which was, I had 2 kids, and my wife is actually from there, and she was like kicking and screaming. She's like, I didn't move out of Fort Worth, Texas to like go back to Texas.
Wow.
But I really wanted to do the fellowship. I felt like it was going to make a huge impact on my career. And we did it, and happened to turn into the COVID era. So being in Dallas wasn't a bad thing rather than New York at that time.
Yeah.
And then once the world started opening up again, I'm like, all right, Dallas has been great, but it's time to move back.
Nice. And in that fellowship, in that practice, they do a lot of rhinoplasties, right?
Yeah.
Well known.
Exactly. Yeah. Well known for facial rejuvenation and rhinoplasty.
But you do face and body in New York.
Yeah, I do everything. Breast and body is kind of bread and butter in plastic surgery. It's what we do most in our training. The facial aesthetic and like rhinoplasty, revision rhinoplasty is sort of more niche and wasn't something that I got as much of. So for me, it was important to become well-trained in that. And so, so I do a little bit of everything, but mainly face and nose, but breast and body is kind of bread and butter.
Nice. Yeah. I mean, I love my plastic surgery colleagues. I learn a lot from them. We exchange a lot of ideas. We help each other out as well. So it's nice to see that we're talking.
Yeah, absolutely.
We're putting an end to the stigma of the divide. Yeah.
Dermatology is so critical, and it's so important for everything that I do, because there's so much that you do that I don't do. Without good skin, and without, like, you could have the most beautiful jawline, but if the skin looks messy, it's just not a good result.
It's true. And I've been taking a deep dive on your Instagram. I love it. Yeah. So there's like a lot of things we can unpack from that as well. So we could dive right into it. So, you had this amazing, reel on Instagram that went viral. It was about you coming home for the holidays and treating all your family members. They're just like lining up. It's actually funny. Go take a look. How is it treating family members? Because you had your mother-in-law on your IG at one point. So
I've operated on my wife. I operated on her mother. I've operated on friends, and I've treated friends and family. I'm sure it's similar to you. I find it to be a privilege. I think for me, it's a way to give back to my family that has suffered so many years during my training.
Yeah.
And I think that it's a gift, honestly, because they sacrificed a lot for us to get to this point. So I think it's just a great thing to do.
How many text messages you get a day about I need a facelift? I need,
Yeah. So, I would say that there's friends and family, and then there's friends and family.
Yeah. Yeah.
There's like
Adjacent.
different, there's different tiers of friends and family. When you go home for the holidays, they're like, can't wait to see you, but we also can't wait to see your Botox.
Exactly. Yeah. They're like, don't forget the Botox. You're like, is my presence just not enough? Yeah.
Yeah. I fear like showing up without it because they're going to be like, oh.
Yeah. Good call. No, I like that you said it's a privilege. It is a privilege to, help our family and treat them. And, they have put up with a lot. Medical school, residency, fellowship, it's a grind. Yeah.
Yeah.
So.
Yeah,
but they don't look like it.
And the truth is that I found that they prefer to be treated by, let's say, me. Like for my wife, for example, she felt like I knew exactly what she wanted and the look that she was looking for. So for her, I think she felt comfortable. And same thing for my mother-in-law. I think she felt like I was going to take the best care of her.
Yeah.
So, and I think we take the best care of everyone, but I think that we're sort of extra focused.
I think you bring up a big but subtle point, is that the trust that goes into this relationship with you and your patient, because like they're going under, you're cutting open a perfectly good face, and then you're redoing it, right? Yep. So like that's a lot of trust. And you've had Dina Lohan, right? And that's a big celebrity. Like it's a lot of trust that goes into you. How do you feel about that? Like,
I think that every patient, obviously, you want the best for them. Certain patients, your blood pressure may be a little bit higher. You're going to be a little bit more focused. For me, I find that to be, I like the challenge and I like sort of the excitement. And I think if you do the same thing every day on the same type of person, it could get a little bit redundant, but it's fun when you have these situations and these people. I think it just makes things a little bit more exciting in a good way.
No, for sure. I think it also shows that, you really need to find someone that you want to work with, right? Like this is a relationship for, the surgery may be one day, but there's like a whole host before and after.
Yep.
Because there's always, maybe an issue beforehand, maybe an issue afterhand, but you have to have that trust. Yeah.
When you meet a patient for the first time, it's like going on a first date.
Yeah.
And it's a lot of first dates sometimes.
Yeah, I know. Yeah.
It could be exhausting.
Yeah.
But it's like a first date and you both have to vibe with each other. Now, you're not marrying the person, but you have to at least feel comfortable with each other. So like you said, if something doesn't go exactly that way, they have to trust that you're going to take care of them. And it is a relationship, and it's a relationship that oftentimes is your entire career. I mean, they're always going to be your patient, always look to you, hopefully at least.
Yeah. And when they come back, that's even a better sign. And then when they bring their family members, that's even a better sign. So it really is this like lifelong, relationship that people have.
Yeah.
I say it's always good to have a great dermatologist and a great plastic surgeon, like along the way. Yeah.
Yeah.
Can really help. Yeah.
It can help a lot. I know. I think my brother's an ophthalmologist, which is not as ideal as a dermatologist, but I think that's every Jewish mother's dream is a dermatologist and a plastic surgeon.
We have a famous couple in dermatology. He was a dermatologic surgeon, but he passed away, Alistair Carruthers, but he was married to an oculoplastic surgeon, Jean Carruthers. She's still practicing in Canada, but they basically sort of discovered the aesthetic Botox that we all use. So like, it's a good pairing.
That is a great pairing. Absolutely.
It's a great pairing. And so when you went to Dallas, you picked up new techniques, you learned new tricks, right? You brought them back to New York. What do you see as the trend for plastic surgery now? Do you like trends? Do you hate trends? We see a lot of them online.
Yeah, there's a lot of trends. And I always think about, when it comes to surgery specifically, you never want to be part of a trend. You want to do something that's timeless.
Yeah.
In general, I'm very conservative, and I'm hopefully doing something that is going to be long lasting. I think one great example is everyone wanted to get their buccal fat pads removed.
We saw it.
We saw it like crazy. Everyone just, especially in New York, everyone wants to just be like,
Yeah, very gaunt.
Yeah.
Yeah, very 90s.
Right. Which is,
yeah.
so you have to be selective because there were so many people that they were taken out. It shouldn't have been removed, or they took out too much.
Over resected.
Yeah. And it's a difficult problem to reverse. And that was super trendy. And I was always very conservative. And I wrote a paper with Dr. Rourke about it. And, that's just one example of something that is trendy that is kind of irreversible. I think in general, though, we're seeing a shift, thankfully, to more natural appearances. And I think, there was the whole Kardashian effect with the big butts and overfilled faces and big lips. And I think we're thankfully coming back to a more elegant, timeless type of look. Are you seeing similar?
Yeah, no, I was actually just talking about this with another dermatologist because a lot of people are in their era of like dissolving filler. And I like to tell people, yes, they're dissolving it, but they're just strategically putting it back in better places, smaller aliquots, more natural looking filler. And it does help over time, but you can't overdo it. And the doctor shopping is really, or even the non-doctor shopping is like, it's a lot, and so people can be getting treated at multiple different places and then all of a sudden they're overfilled or they have like festoons.
Yes.
Yeah. It's an epidemic. Yeah.
Yeah, it is. And half the time people don't even know what's in their face.
Exactly. I know. Are you encountering a lot of filler? Because people have been asking me about this because, they're thinking about a facelift and they're like, should I get filler? I heard plastic surgeons hate filler. How do you feel about and the biostimulatory fillers versus the HA, like when you're dissecting out for a facelift?
Yeah, I think that if those things are put in the right plane, so if you're putting filler, let's say down on the bone or something, then it's less of an issue. But if filler is placed in other parts of the face, it could create scar tissue. If it's placed in tear trough, obviously, people have swelling. It could really prolong swelling after a lower eyelid surgery. Yeah. I think, but today there's no such thing as a virgin facelift. So everyone has had filler, skin tightening devices, and they're not even thinking about that. I'd ask them, I go, have you ever had any skin tightening? And they're like, no. And then I would start listing the different devices. I'm like, oh yeah. So our generation is basically, we're gonna rarely see virgin faces. So we're kind of at this point used to dissecting through treacherous and scar burdened areas. I
have a friend who's a plastic surgeon, and they were like, they found a barbed thread in there. The patient didn't even realize they had threads in the past.
Yeah.
And they were taking out like these barbed suture threads, like from way back in the day. Yeah.
Yeah, you find all types of things. It's like
you're going on a mission. Yeah.
There's a lot of different things out there, and like you said, people don't even know what's in there and what they've done in the past.
And speaking of, we get a lot of questions about deep plane facelifts, and like this is a technique that's been around, right, for a while.
Yeah, that's a great question,
but it's like all over.
It's all over, and I do basically deep plane as well as other variations of facelifts. And I hate to when people say I only do this and I only do that, it's really almost a disservice to the patient because everyone's anatomy is different and not everyone needs everything. So if you tailor it to the particular person, I think that's going to give you the best results. In terms of the deep plane, I think it's a great operation, but not everyone needs it. Mm-hmm. And there are some more risks when you're dissecting around nerves. Oftentimes it's interesting because I'll do a secondary or tertiary facelift and the patient will have had a deep plane, quote unquote. And half the times that deep plane has been untouched. So
it's intact, yeah.
So there's a lot of people that are saying they do it aren't doing it, or saying that they do it and they're not doing like a true deep plane, like you mentioned, was described for many years. And a true deep plane is you lift the skin just a tad and then you go right under. But one of the issues of doing that way is that you really have difficulty correcting the gel. So then people do this hybrid where they elevate skin, go deep, and then they release that. So, and it's confusing for patients because they start to get very technical. About
sure, like they come in with like their whole layout.
Yeah,
especially in New York.
Yeah, so I just confuse them. I say I do a hybrid dual deep plane 2-layer triple backspin. I just throw it right back at
for
them.
The dismount. Yeah.
Yes. I just I'm like, yeah, I do that. And I do like 10 other moves. And then they get really confused and they're like, or they're very impressed.
Yeah. I'm sure well, you have great results, but intraoperatively, you're probably encountering things that you have to then now pivot for.
Yeah, absolutely. You have to feel comfortable doing all these techniques because sometimes you have to switch up the game plan. And really every patient is different. But yes, I do find it to be very interesting. Patients seem to be very knowledgeable, with specific techniques, probably more than most residents, honestly.
Yeah. They've done their homework. Yeah.
They've done their homework.
And I do think social media is a blessing and a curse because you can research a lot of technique, but you really don't necessarily understand that technique or why it's used. But then they also can see really altered images of, weird lighting, different positioning. And there's a lot of trickery out there.
It is tough because I'm more of a purist and I like before and afters and I'd really try to standardize the lighting and the positioning, but certainly you could very much manipulate lighting and positioning to make the nose appear bigger before and make the nose appear smaller after. And with skin, I'm sure lighting and double flash photography and etc. It really is hard. And I think consumers are getting better at picking up kind of somewhat altered type of imagery. I think they are smarter than sometimes some people give them credit. Yeah. But yeah, you're absolutely right. It's a problem in general.
Yeah, I mean, I kind of like the educated patient because it gives me some conversation with them. We also are seeing a lot of trends in dermatology where the patient's getting younger and younger and younger, and they want to start these procedures earlier and earlier. And, in some respects, from the natural aging and the biology, there's probably some merit to starting things earlier. But then when is early too early? Now people are talking about facelifts in their 40s or 30s, and is it worth it? Is it worth it to go underneath there? The longevity of the procedure. What do you think?
Yeah, and
rapid fire question.
No, this is good, and I there's definitely a big shift and trend of women getting facelifts at a younger age. I think some of it came from that extreme of the overfilled aesthetic, and now they're like, okay, I want to get rid of all of that and I'm just gonna get a facelift and you're gonna fix everything. There's something to be said of a good facelift, of restoring volume in the mid-face and cleaning up the jawline. But whenever people ask when is the best time for me to get a facelift, really it's not a one answer. It's based on everyone ages at a different pace. I've seen women in their 60s that have better jawlines than some women in their 30s.
Yeah.
And a lot of it is just, it's so individual. There's really no specific age. I think what it comes down to is once you have jowling and it gets to a point where you don't like the way it looks, it's really hard to fix jowling. Yeah. You could camouflage it, you could do things to but it's really hard to do type of procedures that could really lift it and reposition it.
Yeah, it's a tough one.
Yeah.
Yeah.
But I do think the one advantage of doing something younger, the one positive side is that patients tend to be healthier, they're more active, so the recovery tends to be quicker.
Yeah.
As they get older, once you're in your, let's say, 60s, 70s, there are typically more comorbidities and things like that. Now, not to say that if you do it in your 40s, are you gonna it's not going to last forever.
Yeah.
And I think that's kind of what you're getting at. Nothing lasts forever, but obviously good skincare and good habits, things will last longer.
Speaking of habits, with GLP-1s now, are you just seeing a boom in body contouring, skin redraping?
Yeah, I think with all weight loss that people are experiencing, they are, I think, two factors. One, they start to feel good and they're like, wow, I haven't looked this good since high school. And they're like, wow, I'm looking good. And they're like, well, I could look even better if I, do some type of surgery. So it kind of is like a snowball effect. They're like, wow, I look good. I'm like, wow, I could look really good if I do this.
Yeah.
And then there's a loose skin component. They lose a lot of weight and they have loose skin, whether it's on their face or their tummy, it's definitely driving a lot of surgery for sure.
Yeah, I feel like the cool sculpting industry is down.
Cool sculpting's down. I think bariatric surgery is down.
Yeah, body lifts are up. Yeah.
Body lifts are up. I think as a whole, it's been good. I mean, I think that most of my patients are on GLPs. You know, they're like microdosing, whatever that exactly means. But people are taking it, and there's other benefits. You know, addiction. There's things that people like about it, that not just weight loss. But yeah, I mean, it's definitely driving a lot of consultations and surgery.
And do you do it while they're on the medications, or do you tend to wait until they're really at the end of their, body transformation?
Yeah, so that's a good question. In general, you want people to be at their goal weight, because you don't want to do a surgery that removes extra skin and then they go on and lose another 30 pounds, because then they'll just have recurrent laxity. So you want them to be at a stable weight. And then in terms of specifically being on it, safety wise, they need to be off of it for 2 weeks before surgery. Just from an anesthesia standpoint, they could have reflux and aspiration.
Yeah,
so
delayed gastric emptying. Yeah, I mean, some of my anesthesia colleagues don't love that. Yeah.
Yes.
Yeah, they, because when they're under, they have to make sure they're not eating. So that's really important. Yeah.
Yeah.
So speaking of, sort of the worldly approach to plastic surgery, I did do a tele video conference with a plastic surgeon in Asia, Waffles Wu, who is amazing.
Yes, yes.
Yeah, and he was talking about his experience in Singapore, in Asia, about just sort of the cultural differences. Do you feel like there's a difference between West versus East techniques or trends or look? Yeah,
definitely. I think there's trends. There's differences in trends between New York City and Queens.
Yeah, it's a whole nother world. Yeah.
Yeah, there's tremendous variation. Even just like between New York City and Dallas, New York City, Miami, there's definitely different aesthetics. In terms of Westerner, definitely differences. I mean, even if you look in plastic surgery done, and this isn't necessarily the part of the world that you brought up, but in like Turkey, if you watch some of the results coming out of Turkey when it comes to rhinoplasty or brow lifts, that's another sort of very trendy thing.
Very trendy, yeah.
Young women are getting sort of very overdone, unnatural appearing.
Like the foxy eye.
The foxy eye. There's definitely tremendous variation in terms of the aesthetic. And that's why I think that patients will gravitate towards you, or they'll gravitate to someone else based on what you're showing them.
Yeah.
And that's why I think social media is helpful, because they show up to you because they say, okay, I'm going to, look like this patient that he posted on social media. And I think that's helpful.
They want to vibe with you, If you're only putting out foxy eyes, you're only going to get the foxy eye patient.
Yeah, absolutely.
It's real. I mean, that's also really interesting, because it's almost like appropriating different ethnicities onto different faces. It's really like a cultural identity that's happening. Yeah. It's interesting.
I think that it's important, whether you're operating on a man or a woman or someone from the Middle East or Caucasian, you want to retain their ethnic characteristics or their gender characteristics, because the last thing you want to do is feminize a man or masculinize a woman. I think it's really important that you do have to tailor your surgery towards ethnicity and gender a lot.
Yeah, it's a great point. For the budding plastic surgeons out there, do you have any advice, as we wrap up? I think it's one of the hardest residencies to get. Yeah.
Almost as hard as dermatology.
Yeah.
You obviously have to study hard. You got to do well. That's like without, and then I did a lot of research along the way and getting involved with different projects, and also spending time with, I have people shadow me often, as I'm sure you do.
Yeah.
And it helps keeping you focused and putting the eye on the prize, because it's a long road, even though it goes fast. But if you remain focused on what you want to achieve and you work hard, then you're going to get there and you'll be super successful.
No, couldn't agree more. And it is a long journey, but it's worth it. I mean, we're fortunate enough to be in wonderful practices and like meet amazing people along the way. Yeah. So congratulations. Yeah.
Thank you.
Thanks so much. Yeah. Thanks so much for listening to this episode of Give Good Face. Subscribe on Apple Podcasts, Spotify, YouTube, and wherever you listen to podcasts. And follow along on social at Dr. Anthony Rossi and at Rossi DermMD.